just have a panel discussion with all our speakers today, and you can ask all your queries, any doubts, even if they are small, specific doubts. Please don't hesitate. I think one common question in everybody's mind is how to choose a subspecialty, because we've all spoken about particular subspecialties and how to go about pursuing your fellowship in your subspecialty. But most of the residents or newly passed out, young surgeons, one doubt in their mind is how do I choose my specialty? So, I mean, if one of you could tell us, perhaps Chasnal Madam, how you chose pediatric orthopedics and how should others, go ahead and choose their specialties?
So, like I mentioned, that if you have not decided during the residency which branch you want to take up a SR-ship in a place where you get a exposure to all the fields, and maybe then you can develop interest that which one you want. But whatever you like the most, you should do that. Not because XYZ branch gives more money or there's less work in some field. Don't do that. If you like it, you'll excel in that field. So, but just take what you like and try to get exposed. Suppose during your residency you didn't get exposed to spine, so find a place where there is more work. Go there. Maybe you might end up having more interest in spine as well. So I think a SR-ship might help.
Okay.
Sometimes for me the internship helped. I had decided in internship to take up ortho.
To pediatric orthopedics?
No, ortho.
Okay.
And I wanted to do spine. The best part was I wanted to do spine, and then eventually I did pediatric
orthopedics. Okay. Sir, if you could share some.
So I think most of the times the subspecialty interest is determined by the person who has inspired you the most or your teacher. At different points in your career, you will come across a lot of people who you would want to sort of look up to, or you would want to emulate their practice, their mannerisms, their behavior, and that sort of also shapes into a subspecialty. Having said that, it is not necessary to settle down into a subspecialty, as Dr. Samir Dalvi mentioned in the morning, or you can sort of preempt what is going to come next. Like someone was, like Dr. was mentioning about foot and ankle, that we are lagging 15 years behind. So whether it is going to come in. So either you can be someone who would see the future and want to settle in that specialty, no matter how interesting or boring it is. But I think it's more so who has influenced you and whom you chose to emulate. Because the gist of whatever has happened in the morning, everyone has said that fellowship is more like an apprenticeship. Nothing happens in the short term. It is a long-term thing, and you, apart from surgical skills, you are going to pick up a lot of life skills from the person whom you are working with. So it's more like an apprenticeship that you just shadow him, see how it works, and whether you want to do the same thing.
So would you think that it is a good idea to spend some time in all specialties before deciding, or if during your residency you like something, just go with it and pursue that? Because somebody might not be exposed to spine or say tumors in the residency.
So 100% get exposed to everything. You have to be a good generalist first to be a specialist. So there is an interesting book called Range. So that Range, the title of the book is that the importance of being a generalist in a specialized area. So the book talks about the CEOs who have done wonders and who innovators. So if you see that they are all in their 50s or after 50s, they have done wonderful things because they have dabbled with different aspects. So I can tell about UK. So if you are planning your career in the UK or you want to apply, what looks good on your CV is that they don't want you to have done 3 years of orthopedics. They want you to have done a little bit of vascular surgery, a little bit of plastic surgery, a little bit of emergency medicine. So when the person comes to them, they say, okay, this is a person who has seen the world, who has seen different specialities. He's a good generalist. So he will be able to get out of the situation when the radial artery is lacerated. Or he will be able to, predict what happens when a compartment syndrome is there or a nerve is injured. So he's got a range, and now he wants to specialize in one thing. It also works the other way, that when you have a range, you can bring in the best part of one specialty into others. Like for example, now endoscopic spine is coming in, but a lot of concepts have been borrowed from soft tissue scopies. For example, arthroplasty was leading the innovations, let's say in the late 1980s or 90s, but the same concepts are now being borrowed by the spine surgeons with regards to their modern instrumentations, them moving away from anterior surgery to posterior and now coming back anterior. So it's best to have a range initially and then settle in a subspecialty.
Siddharth would like to add something here.
So, one of the most important factors is there is no pressure of time. I think one of the things which sort of gets into our minds, especially in residency, is that as soon as you finish residency, there has to be a decision to take a specialty. It is true to a certain extent, but what has to be kept in mind is this something that you are going to do for the rest of your life. You can't be in a position that after 5 years into a particular specialty, you feel that that's not right fit for you. There's always going to be an option to go back, but those 5 years have gone. So spend time and don't rush into making a decision because there is no peer pressure. Once you've finished your MS, once you've got your degree, your only enemy is you. There is no other competition around which you have to tackle. It's the planning for the rest of your life which begins, and it's like a mutual fund SIP. It's a small amounts, but in the longer run, it gives you dividends.
And I think there is one, a perception that you start your specialty or start earning as soon as possible after your MS. But I think most of us, most of the panelists here would tell you that spending at least minimum 4 to 5 years in pursuing and learning your specialty is going to make you more mature as a doctor and as a surgeon. So the next question really is that once you decide that this is my particular subspecialty I want to pursue, when is a good time to start applying for fellowships? Is it during residency itself? Or is it after residency? So when did you start applying for your fellowships? Maybe you can start with Manit.
So, like I've told you, I was exposed very early on. I had a direct interaction with my mentor. It's important, if you want to apply for a fellowship, you reach out to the center, you talk to the mentor, get on in a discussion with them, understand what they require from you to come in as a fellow. That is the most important. What are your basic requirements? Like I said, my mentor sent me back to complete a year of rotation through all specialties and then come back and confirm to him whether I really want to do this as a specialization and take it on for the rest of my life. So understand what is required of you before you start your fellowship. You can do that during residency, there's no problem. If your mentor says he wants 2 publications of you, start early on in residency. If he says he wants this much of years of training on you before he takes you on as a fellowship, start early on in residency, get into a dialogue, that is the most important. Understand what is required and achieve those requirements so that then you are straight away assured the position when it's time.
Okay. Thank you. Parag sir, when did you decide that you had an affinity towards hands and when did you commit?
Honestly, it will mostly happen after your post-graduation, in my opinion, because it is very difficult to take that call during post-graduation because of other, unnecessary liabilities of many things. But it happened to me after my post-graduation. Everybody has gone through the same. We all were clueless, and trust me, like whoever, like she is a pediatric ortho, but she wanted to do something else. So almost 60 to 70% of the people who are there today, they wanted to become something else, and they landed up, becoming something else. And to enter into this subspecialty, you have to see yourself, answer 2 questions. Where do you see yourself in next 5 to 7 years? And not from career point of view, but from geographical point of view also. So one thing, decisions people usually now this generation take, whether I am going to move abroad or I will come back.
Yes.
Okay? But of course, everything is going to change. Everything is going to change. Once you are, after 5 years, India is going to be like a corporate practice, and the things are going to become better.
Yes.
But decision is what you see, you are going to, go into that specialty more. The things that you are less exposed, you will definitely have less attraction to that.
Yes.
But if you want to increase your horizon and in terms of thinking, start attending, BOS courses, small courses. That is the best thing that we should do. Do hand surgery course, pediatric ortho course, arthroplasty course. Do these courses because you immediately get separated amongst the 5,000 postgraduate people to immediately 20 people who are attending that course, and suddenly you have one guidance. So whatever you have left out or missed during your post-graduation, you are immediately get exposed to that particular, faculty, mentor course during that. So it is my recommendation, if you cannot decide during your PG or within 1 year of PG, try to do courses, in various subspecialties.
Specialties.
It will definitely help you.
Yes, and a lot of times your life decisions and your life situations also play a role. You have to take all that into account. Yes. So in terms of applying for fellowships, there is always a lag period. Yeah. So how soon, should one start for formally applying for fellowships? When do you think that, is a good time to start formally applying for fellowships?
I think you have to be generalist, as Dr. Ashish mentioned.
Yeah.
But because of competitive, imagine you are not the only one who is applying from Mumbai or your local region or from wherever you have done the PG. The entire world is approaching for that particular post. That has to be very clear, okay? And the entire world also have those powerful or, influential mentors. So you have to think about it in time frame. If you want me to answer, is at least within 2 years, whether I am going to do a general trauma practice with some interest in scopy, plasty, hand, or onco, some certain like that, or I am going to be a specialist. Trust me, irrespective of the money that you are going to get during your fellowship, that is also myth, that I will earn less, I will not begin. If you start your practice immediately, you are not going to start earning immediately.
Yes.
And trust me, the moment you enter into any subspecialty, the path is so encouraging and nice. The moment you enter into hand surgery, suddenly attending conference, you are interested in congenital hand, micro, brachial plexus, something like that. So, and everybody pays, either in terms of time or knowledge or money. So you are not going to, lag behind earning.
Yes.
You will keep earning during those fellowship. It is only starting a practice, that is the discussion. Not earning money. Fellowships are unpaid, but they are paid in lot of terms.
Yes, you learn
within 2 years,
life
you
skills.
have to make a call to join any subspecialty. After that, the lucrative capacity of orthopedic practice, it goes in your mind, and very, very likely, you will see, why should I take that risk if I see 100 patients in OPD and charge 500 rupees, and do injection practice, do K-wiring practice. It is not bad, and you will settle that with South Bombay also and 2-tier cities also with that mindset.
Yes.
But take that call within 2 years.
But most of the fellowships, they have a lag period. So there are, there's a waiting period. As if you apply now, you'll get it after 2-3 years. So in terms of application process, as Madam said, that initially you work in a unit and then you realize, and then once you start applying, you suddenly realize that the next available fellowships is 2 years from now. So how do you fill in, that gap? What do you do to make the most of those 2-3 years?
So I'll just start by answering
Sorry, yes,
one
apologies.
question. So when to apply, you'll have to actually make hundreds of applications. I think everyone sitting here has made hundreds of applications.
Absolutely.
And things are very easy now because of portals like what Dr. Ashok Shah has started. Ek portal pe you come to know everything. NHS.net pe you get to know notifications. So we had applied at an era when they were all postal applications. And as Dr. Parag said, imagine there are thousands of people from Scandinavian countries, Bangladesh, Pakistan, Sri Lanka, everyone who's fighting you. They don't know you're from Sion or you're from KM or you're from Sancheti or any other place. For them, everything is the same. So what matters is your referee. But if you don't have a good referee or a powerful referee, just start applying. And my tip will be to have different CVs for different sort of applications. There will be some applications where they would want a senior registrar post, someone who would want junior post. So you have to tone up your level of experience or tone down your level of experience, tone up your expectations, your life aim, ambitions according to those. So just make sure you have 10 or, not 10, but at least 6-7 different sounding CVs.
Yes.
Either for different countries, positions.
And perhaps talking to the previous fellows in that particular fellowship, that helps a lot to know what exactly they want out of a fellow and what stage of career they want a fellow to be in.
Yeah, so even when you're applying, when you start applying in the month of Jan, by Feb, you would have got an idea, okay, this is working or this is not working for me. So you'll keep on changing those. So you saw the sequence, whether it is a consultant-led fellowship or a societal fellowship or a country thing. So you'll have to make your CV according to that particular specifications.
I think Siddharth wants to add something. Yes.
So just building upon that, timing of application actually starts when you are in residency, and that's Dr. Parag has actually highlighted that. It starts with the courses, because one of the things that is going to count on your CV is your previous experience getting exposure to your specialty or a different specialty. The course will do both the things. It will help you get exposure to all to be able to decide. And secondly, when you're ready to apply, you will have done those courses to go on your application. Because once you decide, then if you start pursuing the course, something like an AO basic or AO spine or AO trauma course, it adds that time, because most of these applications, to stand out from the crowd, you need these smaller nuances on your application, because although you can apply multiple times, but your first impression is the best one. So you would want those smaller things to be ready by the time you are ready to apply, or once you've decided to apply for a
So
specialty.
Siddharth, how was your timeline? So you started your Nottingham fellowships in 2018 or 19. So when did you apply? When did you get accepted?
So in my case, it was a biased decision, because I had in Sion we did not have arthroscopy when I was there. So exposure was, out of the 3 years of residency, I had almost a year and a half of spine, 2 years of spine. And the liking and the fondness came by second year. And third year, my whole year of Dr. Gokhale was spent in spine, and the SMO year was under Dr. Gokhale. So it was a biased choice made early. So I started application.
So your residency was on spine, essentially.
Residency was practically in spine, because first year otherwise was blank. So applications I started as soon as I gave my MS exam. So in the time,
Even for the foreign fellowships, because by then
so
you
that
decided
time
about
it was not
spine,
more of fellowship, it was more for observership. So I
Correct.
did my first observership in my SMO year as soon as I started. So that knowledge came from talking to peers. So there was it was not more of a self-research, but it was more talking to like forums
Yeah.
like these. So that's where, and I did the observership more to get on the CV. The observership was in Hong Kong for a complex deformity correction, which I had no clue about.
Yes.
Right. So, but I knew that at some point that will count for something.
Correct.
And then came the ASSI fellowship. The 2 years of ASSI was spent in planning. So it's all about what's the next thing.
Yes, you
And
get one thing and then you start
planning while you're
thinking
doing
ahead.
that first thing.
Correct.
So in the second year of ASSI fellowship was when I applied for the
Nottingham
UK.
Spine Fellowship. Yes.
And the time between me getting selected for UK and me starting was year and a half.
Correct. So
I
exactly, that's what I
interviewed
meant.
for
that,
UK
yes.
almost quarter to 2 years before the fellowship actually started.
Because-
So that's why the highlight is time is going to be long.
Yes,
So you need that void filler to be there,
exactly.
but you need to plan and
So you need
prepare
to fill up that time with some
With something.
worthwhile job, which is,
Exactly.
adding to your skills and helping you in your eventual
Absolutely.
goals.
So what I would suggest is, if there is like I had a ASSI fellowship, but just in case if I didn't have, my plan B was to approach a mentor directly to have
Correct.
a 6 months or a 1 year under them, even if it doesn't pay.
Correct.
Because I think at that point, as Sir said, it's not about the money. It's
Yes.
about just getting that experience and making most of the time.
Sir wants to add something.
To fill up the gap, for example, I wanted to apply for a hand surgery fellowship in Singapore. Paperwork for was 1 year, and after that they will choose whether I will get the fellowship and something like. So the best way to fill up this gap is you have to spend money. You have to attend their national conference and try to present your work as a case report, as a poster presentation. So suddenly in a Singapore Hand Society meeting, there were only 12 Indians. Out of 12, 9 were faculty and 2 were some like me, at the age of 28 or 29. And when I met somebody who was a fellowship coordinator or in charge, and G. Huzuri, in terms of very ethical and scientific way, sir, I have applied for this fellowship, my paperwork is going on, and I have presented this poster or free paper. Suddenly that gap becomes
Yes.
reduced to significant.
You have to make yourself visible. Yes.
Because they understand, by looking at me, probably they make an impression कि मैं कामचोर हूँ, या कैसा हूँ, am I good, bad? So they will ask 3-4 questions. And immediately they will, who was your reference? I told them that nobody has referred me yet. Okay, so they will just call, okay, from where you have done your post-graduation. The moment you say City, Mumbai, they know somebody who is 30 years senior to me. How is Parag? He's good, okay, he has applied. I am very sure your timeline will,
Yes.
So try to attend their local meetings, but not to clap. You present.
Yes.
You present and meet people in any
Yes.
terms.
So I think networking plays an important role in getting fellowships. So perhaps Manit, you can tell us
Again,
about.
if meetings, presentations, or just go and observe, like I said, get a one-to-one face-on interaction. You apply for multiple fellowships, you will get multiple rejections. Write back to them, I'm okay for a month's observership, I'm okay for 6 weeks observership. I'll come at my own money, let me come and just have a look at your center and let me just come and see how things work.
I think it is important for them to find out that you are reliable, you are relatable, you are hardworking and reasonably honest. So that happens after a one-to-one interaction.
Right. So I know I'm sort of jumping the session a little bit, but to question to both of you, because both of you have worked in the UK. Now, if you have to decrease the timeline or do something in the meanwhile, the most predictable path to follow specialty probably is to go to UK.
Absolutely. Yes.
So would you recommend that, while they are at their stages in their career, probably most of them are post-MS, maybe 1 or 2 years, that they mentally start planning for the country where language is not a barrier, path is predictable.
Yes.
And then once you land.
Yes, absolutely. I mean, that is what my thinking was when I chose to go to UK. And I think another thing, as sir said, where you are in your life also makes a decision. I was already married and my wife is also, she's an ophthalmologist. So for both of us to get fellowships in the same country, I think UK was there's no other option really other than UK. Also, while in UK, you're working as a registrar, so you're learning on the job. So till you get an eventual fellowship, you're not really wasting that time. You're earning and you're gaining skills. So that is why for me, I think UK was a very straightforward option. I'll cover that in my talk as well. So yes, so networking definitely helps. And as Dr. Samir Dalvi said in his talk, that eventually, especially in the foreign countries, word of mouth has a bigger impact than hundreds of publications which one might have. And it is very important that if somebody picks up the phone, especially on your behalf, and puts in a word, then that carries more weightage than 10 pages of CV, personal recommendation. But still, I feel that CV also has a role. And how much do you feel, publications make a difference when you apply for fellowships?
So I think application that we send is eventually a piece of paper. So
Correct.
that paper has to reflect who you are. So there are two parts on any application which I feel are very important. One is the research aspect. Probably we'll cover that in the research talk, but the research aspect, and this is from my personal experience being on the interview committee for Nottingham, where the research was not done to see the numbers, but it actually just showed that acumen to be able to, because when you publish a paper, you will do a literature review, you will
Yes.
write up, you will take the efforts, if it's a clinical study, to do data analysis, statistics, cross-reference, do a plagiar check, do the publication, do the
Follow-up
editor sends
and-
back, do the follow-up. So it's that effort which counts and not the actual actual publication. Like for my own exam, my first 3 publications were non-PubMed indexed journals. In fact, my first one was in a journal called European Journal of Biomedical and Pharmaceutical Sciences. Alright, it counted for nothing, but I still
Yes.
paid 2,000 rupees for that publication because I knew that would be probably just the first step to.
It establishes at least a tendency that you're going to
it
be
does that.
a part of that process,
And
able
the
to process this.
second part of the application, which I feel is very important, is your personal statement. I don't know, I think we may cover that in the application. But the personal statement is where you write who you are and what
Yes.
you want from the fellowship, which every fellowship mentor would look at. They probably will not see how many surgeries you have done. Exactly.
And the other thing I feel is important in terms of publications is that most of these high volume centers, they have fellowship mentors who themselves are very busy. So they don't have time to publish their own work, to process their own work. So when you apply with evidence of being published, and when you show a tendency to be able to process data and churn out papers, you are indirectly telling them that whatever data you have which is unpublished yet, I'll be able to churn that and, give you a few publications, because eventually it's a two-way thing. You are going to get some things out of the fellowships, but what do you bring to the table as trainees? There's not much you can give, but this is definitely one thing where you can be an asset to the unit where you're working in, to publish their data. I think that tendency is established in your CV if you've already got a few publications. Madam, you wanted to add something? Yes.
So I think apart publications might hold 20 to 30% importance in a CV. What they look out is how what other courses we have done, like a basic life support or a pediatric advanced life support. So for me, it was an additional thing that I had done PALS from the Accredited American program. So that was an additional thing. And every time I went for the fellowships, the initial, what we do induction here, they used to have a BLS program
Yes.
for all the fellows. So I did that 2-3 times, and they were very happy that I had done the pediatric advanced life support. So doing a basic AO course, basic life support, all this additional
ATLS.
things, ATLS, all this add to the CV.
So in the UK, you cannot be a registrar or a fellow unless you have ATLS, certified ATLS trainer.
And they put some like a sticker or badge on your cards that they know that you are a BLS you have done and you have the capacity to save
Resuscitate
someone.
someone. Yeah.
So that is important, and apart from that, you should also show as a personal person what all hobbies you have, what you read, or something has to come up. Because they are not all the time like academic. They enjoy life more than us actually. Other countries have a much more better quality of life, and they look out that what this person does other than just working. So I think you could just apart in the statement purpose, the purpose statement or SOP, the statement of purpose, you can always put down what other things you do other than the ortho part also.
You wanted to add something, Marathe?
Again, I mean, we lay a lot of stress on publication, but like all of us have said that the paper is the most important thing which your mentor or whoever is going to select you is going to read. So, right, it may be insignificant to you right now, but write about it. How many journal presentations are you doing? It may be a poster, just say 20 presentations in the course of 5 years. It may be a regional conference, it may be national. Say, they don't need the topics, they just need you to know you've done so many presentations, podiums,
Correct.
posters, you won awards, you participate in courses. They want to know how interested you are in the subject. They don't want to look at those 20 publication titles or your presentation titles, but they want
Absolutely.
to know you're interested and you're taking the effort and you're continuously involved in learning and teaching and everything.
You wanted to add something, sir?
Just
Yeah.
a small, I will open a matter for debate and people may not agree with
Okay.
me. That
That's what we are here for. Please, go ahead.
Presentation weightage is more than 80% rather than publications. You have to be extremely smart. But if you go there and really show your too much interest before and during fellowship publications, you will be taken out from clinical work and given a research fellowship. Okay, so please be very, very careful. Your aim is to enter into the system and go through their website what matters to enter into the system. If they want more publications, yes, it requires. But otherwise, one of my very good clinical fellow colleague, he was taken out in our, we were selected both together in Louisville, Kentucky for hand surgery fellowship, and he published almost around 60-70 articles before he reached there. And we were both given a clinical fellowship, and within 3 months, we were offered $5,000 salary, and he was given $7,500 salary. And they told him that out of 1 year of clinical fellowship, you go 6 months into research fellowship and 6 months into clinical fellowship. Okay, he thought I will be able to take out time and come, and do clinical work. But it's a completely structured program, research fellowship. They will.
Make sure you
that
churn out
you
papers.
publish,
Yeah.
and they will give, there will be, it's a different team, statistician, this, that, PSM people.
So sometimes it can work against you.
Yeah.
But I think that is an exception rather than the.
So, I mean, again, to emphasize the same point that, make sure where you're applying. And that is a very important point Dr. Nikhil made, that, they are looking, so what you are bringing to the table, I'm offering fellowship to this fellow, he's already knows how to publish, so basically he will help me publish, because ultimately you have to remember that those people are getting a grant or getting a fellow's position financed by someone else. And that someone else either might be wanting to evaluate his particular screw, his joint, his newer technique or Botox injection or whatever. So they will want the paper at the end of it. That is one. Secondly, you might be applying for jobs where actually they want someone to work in the ward. And that is where publications may not count too much. So you might be lucky over there. But my sincere advice will be to make sure that column is filled. That is one. Secondly, if you are the person who has a recent bent of, by all means, that's a very good fellowship and good program to get into. It up there, because when you're a senior, then they're going to look at your JPJ's publication, Journal of Art, very, very heavily in your favor. I think that's the question you want to ask.
Can you have
As all of you are saying that there is a waiting period for 2 years. So like for example, I start applying today. In the next 2 years, whatever I do, maybe for example, if I'm applying for a plastic fellowship somewhere in Australia, in the next year, if I do further 2 more fellowships, 1 year, how do I convey to them that in the last 2 years, I have done 2 more fellowships? Because 2 years will be a very big time. 10 lectures, things. How does that institute come to know that I have further trained myself in that?
So generally these fellowships are filled, the spots are filled in advance. So now what you're applying for might be a 2026 fellowship. So in 2 years' time, it will be a 2028 fellowship. So your 2026 application will be based on what you have on your CV today. So those next years will be whatever for the next year's fellowship.
So they would send a letter of approval anyways, is it? 26?
If you get in.
Period here is like your application is accepted and you're waiting. It's not the opening of post. Opening of post, what is
So when Siddharth said 1.5 years, he was already selected for the fellowship.
already selected, evaluated
Based
your
on his
application.
CV at that point, he was selected, and his fellowship started 1.5 year later.
So for your 2 year later start, the 2 year period
Yes.
doesn't matter, because you've already been selected now, and then you spend that 2 years to fill the void, because the course starts 2 years after the
Correct.
And how big of an hindrance is a language barrier? Like if we choose a 6 months fellowship which is in Korea probably. So I was born and brought up in Mumbai. When I went for my PG in Mysore, I took first 3 months to learn Kannada. So if that kind of a problem I face, like for example, if I get some opportunity in Korea and in Australia, so how big will the language barrier be
So Madam has spent a lot of time in
if
Korea.
I am a clinical student there?
2011, entire opening and the software used to show name in Korean language. So it was a difficult thing, and I did additional Korean classes on Saturday, Sundays. So you have to learn a bit of things because
Even reading, you have to, even reading.
Even read.
My-
So I could read the names and I could see.
Oh.
You don't have to interact with them because there's always a R2, R3 who will guide you. And as a fellow, you're treated very nicely. So you don't have to read or worry much about it. The Korean seniors, they are trained in US. So they all speak nice English. To a nice big city, if you go to small cities and smaller provinces, it's difficult. Seoul and Incheon and these places, yeah, you'll have everyone speaking English around.
But patient interaction is going to be a hurdle.
No, so patient interactions is always the physician assistant.
Okay.
Bosses, assistants interact and the R1 or the R2 will interact. The fellow doesn't need to interact.
Sorry, what are R1 and R2? The residents.
Resident,
Okay,
yeah,
sorry.
resident, R1, R2. So the fellow just stands next to the boss and they discuss the cases. While R1, R2 will take the history, they will type for barrier. Simple things like name and all you need to read for which case is being shifted and you can't be dependent. So it's easy to learn, not a difficult.
I think Australia won't be a problem, I think.
How much
Australia
time did you take to manage this? Like for example, if it is a 6 months fellowship, so how much time would I probably take to learn that language so that I can
It's like 2-3
just manage my
sessions
work?
you'll learn to read the names. They're very simple. They're phonetics just like what we learn Hindi and Marathi. It's very simple.
How much time did you take to learn in Mysore? Maybe that will give an idea.
I almost took 2 to
Yeah, now you can use
Yes.
all
manageable
the
Kannada.
you can use the translating apps. Those guys are really advanced. Those girls and guys, they use the translators and they show you. Even
So now you
then
have
they-
Google Translate as well. You
Yeah.
can just.
So even then they used to
Yeah.
do this with me. So I think now they must be much more better.
When it comes to once you're selected, you have time to start applying for paperwork. You'll apply for a visa. You'll apply for travel permits. You'll
And
apply
take
for a
some
work
language
permit.
lessons.
And you have a lot of time. At the same time, you apply for some language skills as well.
Thank you.
So I don't think so. You have to make a good rapport with local staff, residents and staff, the nursing staff, ward boys.
Yes,
you know,
yes, I agree.
You just make them a good rapport. Indians are very good at it. You know, they
Yeah,
love.
yes, order coffee for people and they love
They
it.
have a lot
Yeah.
of stories to tell. They know Bollywood. You will really love it. And I think it is a matter of 1 week to 10 days. You will accustom to their system. It is so well. You are not the first Indian going there. So they know that you don't know their language. They definitely will help you. It is not the.
It's not a big deal at all.
See, we don't have to deal with it's like I have also done my fellowship in Coimbatore and I learned Tamil in first 1 month. And I went to Singapore where 80% of patients are Chinese speaking. You may have a setback once in your lifetime during the fellowship that, you know, the patients prefer, they tell the staff that I want a local language speaking doctor. I don't want to, you know, they don't mean it, but it is like, you know, some patient comes to me in a Maharashtrian language and if I am not able to satisfy their questions or doubts, they have right to, you know, ask somebody who
knows
knows
Marathi,
better.
yeah.
So you may face it once. I have faced it. That's why.
Just a technical offshoot, there's a very nice app called Duolingo. So, which is fantastic, very easy interface if you want to learn basics of something new or language wise, wherever you're going.
So, the language issue which you mentioned in Korea was actually a blessing in disguise for me because I went there for a very specific spine endoscopy training, and because I could not interact in that language, they cut off all my OPD days. So, it was Monday to Friday OT. So, there is no emergency duty, there is no OPD interaction, you just have to do OT and publish for the bosses because their English is poor. In return, you can do some paperwork for the bosses.
Any other questions? I think there's someone there at the back. How many of you have already started? Are most of you trainees? You've finished your MS? Can I have a show of hands? How many are still in training? So all of you are a second or third year residents, and the rest of them have completed. Have any of you already chosen your subspecialties or have any particular affinity to one particular subspecialty or not yet? So you've chosen. So I think the ones who've already finished their training are perhaps the ones who are committed. Sorry, yes, go ahead with the question.
Thank you so much for the sessions. One question which comes to mind when we are selecting an Indian fellowship versus a foreign fellowship is the volume which one would encounter. So, two sub-questions in this category. A, how relevant is the volume in doing a fellowship? And B, how much actually is the volume difference between India and, say, for example, UK or Australia? Which, for a person like me who's not been there, I presume it would be a very large difference. But then for people like you who've already been there, worked there, so how much is the on-ground difference in the volumes between India and those countries, and how much does it make a difference in our practice? Thank you.
I'll begin with myself.
Yes, please.
Indians, we have a lot of volume, and abroad there is definitely a less volume. That is the answer of the question. And how much does it matter? See, you have to see everything multiple times. Okay, so the first brachial plexus I did was in my private practice. I never ever did a brachial plexus surgery in my 4 fellowships of 1 year each duration. Okay, but by the time I did my first brachial plexus, I had assisted around 150 brachial plexus surgeries. So Indians definitely have a lot of volume. Foreign fellowships are chosen for different reasons. That discussion we will do it later. But the volume definitely matters. But why, in spite of having less volume in abroad, why it is more important? You do I need to answer that question or we will take that during?
No, you can please go ahead.
See, it is not only you need to go to abroad, because see, here you will keep on doing cases. Very few institute in this country, they publish or they keep record, maintain their data. You see volumes and you know the data or record keeping in abroad, and the collaboration with rehabilitation department for keeping scores and you know analyzing patients at 3 weeks, whatever, at 6 months is amazing. And that's where we get time to learn in abroad. The second point is, you know, analysis of, you know, no discrimination in terms of post. You know, somebody who is like ward boy or like here, Dr. Nikhil is telling Chasnal madam, Parag sir, Ashish sir, this sir business goes away in 1 week.
Unless you've been knighted, you're not a sir.
Yeah, so that's why that is what we need to learn.
Yeah.
Work-life balance. So in abroad, people work AM or PM. Like the session starts at 7 to 12 or 1 to 5. So Monday to Friday, 2 sessions in a week are devoted for all people in a research.
Yeah.
You understand? So there, what volume you have already seen or there you have seen, you can take one topic, like one particular topic, and you can use that during your research time. So you get a time to do in your own specialty of fellowship, you know, apart from clinical work, you get time to publish or see their present, work. So that's why abroad fellowships are extremely important.
Also, I feel as far as the volume is concerned, the kind of pathology you're dealing with also matters. Because the population of India is so much. So the pediatric problems will obviously be more in number in India, neglected ones, not picked up at birth. Because, I've not done any pediatric fellowship in the UK, but I remember in the entire region, there was just one pediatric orthopedic surgeon, because everything, DDH, CTV, everything used to be picked up so early and acted upon so early that very few kids actually came on the OT table for surgery. And they have a very strong system of, paramedical staff, nurses, for evaluation of CP and so many other things. And they're managed at a much lower level by these paramedical staffs.
I think, volume-wise, we are very good. But when it comes to record-keeping, multidisciplinary approach, a teamwork, like having a physio, another staff, somebody for evaluation, a OTist, all that they excel, of course. Their numbers are less. When it comes to skill building, we are much more ahead. Compared to their fellow, we as fellows here would have done more work. So hands-on work, of course, we have done much more better in India. What we go for a foreign fellowship is to learn additional extra things which we are not doing here. To learn more minute details or finer details of the work. Otherwise, I think if we keep the same amount of record keeping and do the same kind of work, we'll be far more ahead other than the other countries in that case.
I have a slightly different opinion on that. Sorry, sir, if I may interrupt. So, as far as hands-on work is concerned, I think for specialties like arthroplasty or arthroscopy, I really don't think that there are so many hands-on opportunity available in India.
So, to just elaborate on the point, I was going to say the same thing. Volumes matter. There's no doubt about it. But you are at a stage in your career when even by seeing volumes, you can imbibe certain things unless it's arthroscopy. Okay, we don't have more. The arthroscopy is a different set of skills where you need to have that hand-eye coordination, triangulation and things like that. Why volume does not matter over there? Because everything there is structured including the referral service. So as a trainee, you would want to see repetition of the same thing. 4 hips in a day, 4 knees in a day, or maybe 2 knees, 2 totals, and then maybe a scope here and there. So there, maybe you'll have only 2 OT days, but then you'll have 2 OPD days built up with that. Now, again, as Dr. Nikhil said, let's consider arthroplasty for a matter. You may have a very high volume center even in Bombay, but are you actually going to get anything of substance in that? Maybe you might expose the knee once, maybe you might position the knee, but you will never get to, let's say, balance the knee to the optimum or execute a total knee replacement. Things may be a little different in spine surgery because of the quantum of the disease. Someone like an Arvind Kulkarni, I don't know if you know him, he's got a huge volume. So it is possible that when he's running 2 theatres or like a Vishal Kundani, you will get to do bits and pieces. So that is sufficient in fellowship because that is what at that level you are, because you have seen the basics in your training. Now you are there for fine-tuning your skills, and eventually you'll execute that whenever either you are an associate professor or a lecturer in a medical college or you come back to your practice. So volumes matter. We have higher volumes, but there the volumes, though they are
More
lower in
structured.
numbers, they are more structured. So you tend to gain more out of those volumes. I don't know.
Siddharth wants to add something.
So, orthopedics, when we do, it's about knowing something about everything. But when you go to a specialty, is now knowing everything about something. Alright, so more you see that same thing over and over, the more you gain insight into what is to be done and what is not to be done. So, definitely volume plays a role even if you keep seeing the same microdiscectomy a thousand times, because that 1001 time when you get the chance to do it, you would have seen it enough by your mentor to know what exactly the steps are to be followed. It's a muscle memory that you developed even by seeing it. So volume matters to get that finessed memory to keep running over and over again in the same loop. Secondly, even like speaking UK and spine, so two halves of the spine. So in the UK, because of the structure being the way it is, the mandation is the senior fellow always does his half of the spine. Even if it's the senior most consultant, he will expose his half, then he will give me the cautery and the cobs, right, to expose my half. I will put screws on my side, he will put screws on his side. So that helps because there is a structure to the training.
Yes.
So that factor also, in spite of the same point, because in spite of the volume being low, there are 2 OTs a week, and it's like a government hospital, not more than 2 cases a day. So 5 o'clock everything closes, everybody goes home, has a beer. But you still get valuable inputs even if you're doing just 2 cases in the week.
Your contribution is much more than what.
Is much higher, but that builds up on the base formed from
Yes.
the Indian fellowships. So again, I read my base has to be coming from the.
You want to add something, man? Yeah.
So again, I would say that the volumes are massive here, but short in the long run, I would say the numbers don't matter because it will turn out to be the same. You see 20 spine patients in OPD today, you'll end up with 2 minimally invasive spine opportunities in those 20 patients. There you'll see 2 patients who have been referred
For surgery, yeah.
by multiple screenings.
Yeah.
They have ultimately reached you, and there are only 2 patients who are for minimally invasive spine. So out of the 20 patients, you will say, oh, with big volumes, we have 20 patients here, but ultimately the end goal is those 2 patients. You achieve both of them in the same manner. You are doing the
Yes.
filtration there, it's been filtered through the system.
Yes. One final question, because we'll be soon breaking for lunch. When and how do you decide that, yes, I'm done with my training? See, training is a perpetual process, but when do you take that decision of, going into private practice and calling yourself a spine surgeon or a hand surgeon or a pediatric orthopedic surgeon? So when does one decide that I'm adequately trained now to be on my own and enter private practice?
I'll talk about myself. I couldn't make the call, and I had to ask my mentor on his face, you think
That's
I'm
very
ready
honest.
to enter practice? And he's like, you should.
Okay.
So I think it's ongoing process like we.
Yes, yes.
So couple
But
of
somewhere one has to
fellowship,
start, yeah.
So you can't be a chronic fellow, there are some fellows who are chronic fellows. They do fellowship for 10 years, 8 years, and they're enjoying life because half of the time whatever you have been hearing is the serious part, but fellowship is fun. And
Yes.
it's really nice. So after 2-3 years, you should come back, join as a junior consultant somewhere, and side by side start building your practice. And then there will be some surgeries, or you will find there is some shortcoming, and you should go back, learn it at some other place, do a short-term program again, and gradually spread out your own practice eventually. So 3 to 4 years, I think, is a must to get into any subspecialty.
Yes.
So because then you become a master of that specialty, and you can always have a friend, a group practice, or someone whom you can rely on in cases of very difficult surgeries. Even after fellowship, you just can't come and take up the most difficult case. So there's no harm in having a friend or being in a group.
Also, the
practice.
contacts which you develop, and I'm still in WhatsApp touch with my fellowship mentors, and whenever there are complex cases, I can just send them a text and have their opinion and their perspective on how to go about with things.
I think that call, you will get that call, when to go back and start, because you have done national, international fellowships, and during those 2-3 years, you are going to travel, come back to your local place, attend meetings, and you will realize with discussing your mentors in this country, like, I have done this much now, and then you will get that call. But yeah, 2.5 to 3 years, I think by that time you will, decide whether you want to be on that side of the Yeah, or in India. Very difficult. Yeah.
I
How
think
did you
there will-
decide,
I think
Siddharth?
there will be a personal aspect to that discussion as well.
Yes.
So
Yes.
that decision will also not just be a professional one. It will also matter how, if you're married, what partner wants to do, where they are, because it's both the careers which you are looking for. So it's definitely going to be an individual decision. But definitely one thing is to keep in mind where you want to end up. Like if you have a plan to come back to India. I would say again 3 to 4 years is a good timeline. Basically, that timeline is before you become complacent there, because वहाँ पे you get that
It's
salary.
very easy to
It
become
is easy
complacent.
life. It's
Yeah,
a
absolutely.
balanced life, and if that cycle doesn't break, then like one of my senior colleagues who used to mention, if you want to go back to India, go before you have a kid. All right,
Yes.
because once the kid enters the education system, it's very difficult to come back.
Yeah, there are many factors that-
So
yeah.
there are a lot of other factors, but you need to keep that end point in mind. I want to go back, and then find your moment of calling.
Sir, when does one decide that I'm done with fellowships now and I'm an independent surgeon? When does one know?
Yeah, so as Parag said, that call will come. So a lot of times it is very easy to get lured into something deeper, because see, what you have to remember is you have to talk, you have to network, and the same thing goes on over there. Now you are presenting a paper of your fellowship, you present it to someone who's sitting as a chairperson. He said, "Oh, this looks very interesting. Why don't you come to Oxford?" He said, "Why Oxford? Oxford jayega." The Oxford wala fir Cambridge wala bolega, "You come to Cambridge." So then you get lured into that. And then a point will come in everyone's life when you will decide whether I want to stay there or I want to come back. Then secondly, what is happening to your family and your social circles. And then whether you're at a point to start practice on your own. And one very important thing to remember is that you can never finish a fellowship or all the procedures. Like, two
Yes.
important points from discussion Dr. Parag mentioned. The first brachial plexus surgery he did was as a private practitioner after finishing the fellowship. As Dr. Chasna said, you will need sort of a friend, like they say 2 a.m. friends, that he's also done pediatrics, you also done pediatrics, there is a complex problem. You don't want to let go of the patient at the same time. At the earlier point in your career, you don't want to refer him to elsewhere, but you want to give a good outcome ultimately to the patient. So you need to have a local mentor who would be there, "Okay, you do it, I'll be there besides you," or you need to have a friend. So fellowship is never going to be that you have done all the possible procedures in the syllabus. वो कभी नहीं होने वाला है.
And to be honest, one thing I realized during some of my fellowships, especially at the referral centers, is that there are problems to which even they don't know the solution. And in fact, in specialist centers, most of the cases are like that. So one of my fellowship mentors used to tell me that, whenever you see a happy patient in the OPD, please let them meet me, because I just end up meeting all the unhappy patients. Yes. Because if you're happy, you don't come back and see the consultant. So he used to actually tell me that if you have a, happy patient, just come for a routine follow-up. Please let me meet, because at the end of the day, everybody has their own set of emotions and, which needs to be satisfied. So that's the other thing you realize, that even at those centers, there are questions for which nobody knows an answer to, and building those contacts in a way helps to discuss your complex problems with them and formulate a plan which is workable. So I think with that we'll call an end to the first session. Lunch is ready. Are there any burning questions in anybody's minds? Yes, at the back, Janki. Can we have the mic there, please? Or you can shout if you can. Yeah.
Hi, good afternoon everybody. I am Dr. Janki Chaudhary. I'm just about to begin my third year at Sion Hospital, and this is possibly a very general question for all the panelists here. Sirs, ma'am, what would your advice be to someone like me who's starting off registrarship in a high volume place like Sion Hospital? Because I realized that I'm at the end of 2 years here and they've gone by in the blink of an eye, and I really still don't know how to learn. So what would your advice to someone like me be, and what sort of habits and attitude shifts say in the OPD, in the OR or in the wards would help me and hold me in good stead for my future? Thank you.
Yes, please. Very difficult question actually, because
So basically, believe me, all of us were in the same situation when we were doing our PG. Okay.
Yes.
So even at the end of 2 years of my KM, I was working with really big people, you feel like, you're in the center of the universe, Dr. Lyrie, Dr. Bosle, you don't need to go anywhere else. But at 2 years go very fast, you have not done anything. But fortunately, in our institute, there was a legacy of doing at least something. Okay, and now when I tell our residents here that you should make an effort at least to, so one thing I want everyone to promise themselves from henceforth that you're not attending any conference in which you're not contributing. Okay, so do you understand what I mean to say? That be it a poster or a small, it could be case report we present karo, but if you are going to that conference, you have to contribute to that conference. So once you start looking at things from that attitude, then you will start finding interesting cases. The first thing you can do is case reports. So let's say you're working in SIAN, right? So let's say you're working in Dr. Binodi's unit. You will definitely see some child with a complex problem. Ask madam, I want to write a case report, I want to get it on my system. So the moment you start thinking of that, you start analyzing that, then you will start writing. There are other things which UK teaches us is maybe things like audit. Doing certain things in the department which will improve the output of the department, which will improve the experience of the patients of the department. But I agree that might be very, very difficult in a place like SIAN, KM or any government college, but that is easily possible in a corporate setup, either in Bombay or in any other city. So my advice will be to start with the basic case report, see what you find interesting, maybe a technical trip, try to write it up in a good manner. Now you have ChatGPT, you have plagiarism checker, so writing becomes very easier and every publication has a home. So be it a journal of pharmacokinetics or whatever, you will have a publication and that would sort of, light a spark or something like that. You go on to the next level.
I think the easiest thing during residency is everybody has a thesis. I would say finish your thesis early and look for publishing a thesis. It's compulsory, you have to do it. Most theses today don't get published, so finish early and look for a journal.
I think you'll always find some, boss who inspires you. So, as long as you find someone who inspires you to do one particular niche, I think you can just follow them.
All you need to do is just tell that I'm interested.
So I think, trust me.
I think everyone is in that shaky boat. Having that insight, I think, is important because not everybody realizes till the end of their residency that, yes, so I think that's one good positive point. You have insight that, it's uncharted seas and unsteady waters. Yes, please go ahead.
So first 2 years goes in just finishing the job for that day and going back to the room and having the meal or going out. And that's, I think, practically everybody's story.
Absolutely, yes.
The major shift, probably one piece of advice would be, you would have already done a patella fixation, and this is from my personal experience. I did my first patella in my second first under the supervision of my CR at that point of time. He told me what to do. He was unscrubbed. It was morning 2 a.m. case. But when I did my first patella when I was a third year, was after I read Hoppenfield, knew the exposure, read something about patella fixation from some of the books, just to see whether what I was doing till now was fine. It's not that I was being taught wrong, but it's something just to develop the own insight into doing things differently if there is a need. So one advice would be to start doing the same thing after reading. So maybe the next year anyways is going to focus on preparing for the exam as well. So that would be a thought shift, because when you start reading, you will find new ways of looking at the same issue.
And I think we had a bond to do. So I think that is a very good opportunity, because where you are bonded, you already finished your exams, you're being paid all right, you don't have that much responsibility. So that 1 year I think is very crucial in thinking about things, figuring things out, and utilizing it to plan your next journey.
So Janki, if I have understood your concern properly, is in spite of spending 2 years in the department, you still feel that
that I haven't made the best of my time here.
So don't worry, the process has already started. Okay, your knowledge of orthopedics is definitely better than knowledge in dermatology, psychology. Correct. So if you attend, 1 or 2 social events in your own family, and if your family member asks you, can you see this X-ray and comment? If you will be, I am very sure you will be able to comment. Definitely, you are seeing so much good volume.
Absolutely.
You are on a right.
By osmosis, you're learning, by being in a good place.
Track, so don't worry about it.
So to add on it, the very fact that you are here on a Sunday with us you have already taken the first step. And like Dr. Siddharth said, that after doing a patella, he went back and read. The very first case that I operated was IT fracture fixation. Probably everybody's first case was an IT, and there was some problem with the reaming part of it. I don't know what went wrong, but the patient started bleeding on table. The very first case which I got is independent surgery. Actually, also she kept on bleeding. Angiogram was done and it showed aneurysm in the up and down porous. She had to JJ, that was the place where interventional radio was active at that point. They did some coiling, and it was a very bad start to my first post, very first case that you do. But Dr. Srivastav, who was my mentor, told me to publish about it, and it's my first case report. So things started rolling from there. So bad start, but worked out, I must say, in the end.
Yes, fantastic. Thank you so much. I think we'll break for lunch now. I really thank all the panelists. They have a busy practice, and Sundays are, those opportunities which they get time to relax with their families, have some own time, but still they took time out and came for this event and helped us with their wisdom. So thank you all from all of us. Thank you.